All right, so next we are going to do special test. This special test is called the Lachman's test, also known as the Lachman-Trillet test or the Rickett test. I hope I said it correctly. The positive findings is going to be forward translation of the tibia on the femur and soft, absent, or end feel. Proper positioning for testing is going to be supine with knees flexed to about 20 degrees of 20 degrees of flexion and neutral position. My proper stabilization point is going to be grasping the anterior lateral aspect of the distal thigh to stabilize the femur, and then my stress point is going to be grasping the medial proximal tibia just below the knee joint. The correct movement for this test is going to be, I'm going to apply a posterior to anterior translation force to the tibia while stabilizing the thigh. And basically some compensation is if my hand is too small to grasp the patient's back of her thigh, or muscle gardening is going to affect the test. I mentioned compensation. Yep. So right side is affected, left side is uninjured. You can also do this test prone, but I prefer to do it with the patient supine. So I'm just gonna grab the distal part. Sometimes I prop my knee right below, and then try to rotate, and you pain with that? Yeah. Same side. Any pain with that? All right. All right. So next we are going to do the special test called the bounce home test. There is no alternative name for this. What this test is for is the meniscus. Positive finding is if there is a extension of the knee is not complete. If the extension of the knee is not complete, patient's going to be supine. My hand is going to go on the distal tibia and femur. That's my stabilization. And then my stress hand is going to go behind the knee. The movement of this is I'm going to put the patient in slight flexion, and I'm just going to release the back of my left hand or my right hand and let the knee go into extension, but also leaving it there for support to fall back on. Compensation is if the patient thighs are bigger than my hand. So let's say if I have an O-line person, so that could be a compensation. Patient's right leg is affected, left is uninjured. So I'm going to put the patient in slight flexion, and then I'm just going to release my left hand where the back of her thigh is, and watch for that meniscus. Any pain with that? All right. So next test we are going to do, a special test is going to be the crossover test. There is no alternative name for this. And basically, what this structure test is looking for the anterior lateral and anterior medial of your knee, so rotation and instability. Basically, patient positive findings is if patient reports pain and instability. The patient's going to be standing for this test, and there is no stabilization point, there is no stress point. And basically what the movement is going to be is patient's going to have her uninjured leg go across her body first, and then we'll do the first one, and then after her uninjured leg go behind her injured leg. So we'll show you and demonstrate. So her right foot is her injured side. So she's going to bring her left foot forward first, cross over, and rotate to that side. Do you have any pain with that?
No.
Nope. Now she's gonna take that left foot behind her and rotate that side. Any pain with that?
No.
Nope.